Anyone? What are nutrition sensitive intervention? Here. Now, as per again, I don't want to go into very clear, term that is used. Generally, nutrition sensitive interventions are not used because it's not intervention. It's called program or approach. Nutrition sensitive program or approach. It's not very much specific as nutrition specific. Now, those interventions which address the underlying determinants as per the conceptual framework, the underlying causes of malnutrition, these are called the sensitive interventions, program or approaches. Maybe I'll use here the intervention as well. Now, generally, these are program and approaches where these programs can act as a platform to scale up nutrition-specific interventions. Generally, that's how both are combined when it comes to programming. And here, we are talking about these interventions under nutrition sensitive. If you look at here, it says nutrition sensitive programs and approaches. What are those? Agriculture, food security, social safety nets, early childhood development, maternal mental health, women's empowerment, child protection, classroom education, water sanitation, health and family planning services. Now, if you're talking about A and C services, where does it fall? Does it fall under nutrition specific? Let's say if health sector is promoting A and C program or to improve the A and C coverage, where does it fall? Specific or sensitive? By the definition, it's sensitive, remember. But then ANC program is used as a vehicle or platform to provide IFA supplementation to pregnant women. Let's say if a pregnant woman comes to health facility for ANC checkup, during that checkup, if she gets iron and folic acid, that is nutrition specific, ANC is nutrition sensitive. Are we together? Are we getting the concept? So, not all nutrition sensitive interventions are implemented by only non-health sector. If you look at here, family planning and health services are implemented by health sector. So don't get the concept that specific interventions are implemented by health and sensitive by the non-health sector. It's not true. It's about what level of factor that these interventions are addressing. And then we have a whole lot of that building an enabling environment. Generally, it's called nutrition governance, okay? So these three are very crucial. And if you look at the UNAP 2 document, based on this framework, there are three key objectives. One is to improve access of nutrition-specific intervention. One is to improve the nutrition sensitive, and one is to strengthen the nutrition governance because of this framework that came from the Lancet. Okay? Now, there is evidence. The evidence says, I showed you these 10 specific interventions, the left side. If a country is like Uganda, scale up all these 10 interventions to a 90% plus coverage in this country. Let's say these interventions are scaled up in the whole country and the coverage is 90%. Still, the maximum that can reduce the stunting problem would be by only 20%. That means, that's why we are talking about multi-sectoral approach for nutrition, because 80% potential or the role is coming from other sectors or other than the nutrition-specific intervention. And that's where the role of agriculture, food security, education, wars, trade, and gender comes into play. Okay. Before I again talk about the nutrition situation analysis, I know I have 15 minutes, right? Or 15 minutes gone? It's already 20 minutes. My God. Just give me 10 minutes and I'll run, because Patrick had also discussed about that situation. I just quickly want to run through what are the key studies that currently UNICEF is supporting the government of Uganda, whether it's OPM or Ministry of Health. So these are the key studies that we are doing. And some of them might be useful for NIPN to take the data, but some are different in nature. So we are doing FSNA, which is called Food Security and Nutrition Assessment in Dinu districts. Dinu is a program in northern Uganda, so we are doing this FSNA in 18 districts in northern Uganda. Then we are doing nutrition causal analysis. We are looking at what are the causes for undernutrition or stunting or wasting or anemia, again focusing in the same districts. We are doing at a national level nutrition expenditure review. Right now, we don't know how much budget is allocated for nutrition by, let's say, agriculture sector or education sector, and we don't have a mechanism to track that. So we are supporting OPM to do this study. And I don't want to now go into detail. I'll just show this slide and then I'm done. There are a few studies which are in pipeline. One is we are trying to explore the linkage between agriculture sector and nutrition improvement. What kind of possibility or entry point that agriculture sector can have to improve the nutrition? Because let's say it's very easy at times. We are talking about dietary diversity a lot. The evidence says even if you improve dietary diversity, that has no impact on stunting. No impact so far. It has impact to improve anemia, but no impact on stunting. So that's why we are trying to know the linkage. What are the linkages from agriculture to nutrition? Then, with Ministry of Health, we are doing a child anemia prevention study, which is a cluster randomized trial in Karamoja. Again, this is in pipeline. Then we are trying to know, because we have received so much of report from different parts of this country about misuse and leakage of RUTF. Some are stolen on the way. Some are not used to for those children who are supposed to get it. Some are being sold to the market. So we are trying to do this study, how this nutrition supply has been distributed all the way to the household level. Then we are trying to develop an investment case for UNAP2 in terms of knowing how much budget will need this, the country needs to implement UNAP2. So this is again another analysis that we are doing. This is part of National Nutrition Policy, which is being done. Then, I don't know, Gender Commissioner has already moved out, but we are supporting, in fact, through the Ministry of Gender, we are trying to do a gender analysis for mainstreaming nutrition in their programming and policy. It's very much health sector specific, where we are trying to understand the training and capacity of health workers in terms of nutrition service delivery. And there is an approach which is being implemented in different parts of the country, which is called CQI, Collaborative Quality Improvement and Collaborative Learning Approach, to improve the MNH and nutrition services. So we are trying to document that. We are doing a knowledge, attitude, and practices survey to understand the practices for those IYC of breastfeeding, complementary feeding practices. Then the FSNE in refugee areas, and some of the studies which has already been completed, and one of them is situation analysis report. Again, I don't want to go into the detail of that study. What I'm trying to show you here is, well, just before I come to the situation analysis, just to let all of you know that UNICEF is part of NIPN in terms of technical support, where we are providing the technical support to this project. Again, I don't know how to move this, because there are few interesting findings under this study. And what we did is, we did this work as part of a DFID-funded project called Karamoja Nutrition Program. But then, DFID also fund NIPN at a global level. So we thought, since this report was not published, can we make this report a product for NIPN in this country? And that's where we are trying to add some other analysis and make it a comprehensive report to give a national outlook for nutrition situation in this country. So basically, so far, what we have done is we have used primarily the demographic and health survey data, which was done in 2016, but the report came in March 2018. So we used that data to see the nutrition situation. So I don't want to again go back here. Let me quickly run through. If you look at here, what it shows is, there is a wide variation in terms of nutritional status. Sometimes it's very easy to tell, the audience that the stunting has reduced from, from 50 level all the way to 29 in this country. Now, that's an average figure. And we might be content with that progress that, it has reduced from, let's say, 36 to 29, 7% reduction in this last 5 years. But then, if you look at in detail by region, then there is a wider variation. If you look at even in this slide, sorry, this is about wasting. If you look at here, wasting, some of the regions have above 10%, while the national average is 3.6%. Now, would we as a programmer or person who is working in nutrition, would we be satisfied with that the wasting prevalence is less than 4%? That is the WHO, what you call benchmark, to get satisfied. But then there are few regions where it's above 10%. It's a serious concern. So this kind of analysis gives you that inner detail about the problem. This is just one example here that I wanted to show. Again, stunting is the same. If you look at the stunting, there is a wider disparity across different regions, and that's the same by the wealth quintile. Poor people is more vulnerable. They have the highest rate of stunting. In this country, especially among women, look at the overweight. It has increased by 5%. Now, country is still struggling to address the problem of undernutrition. And we are looking at among women of reproductive age, the overnutrition is increasing. Now, that could be a policy question for Ministry of Health or other sectors, looking at the data. Okay? This is about anemia. I don't want to explain many things here. Some of the things are really puzzling. And through that analysis, you get those answers. In DHS, if you look at the trends of anemia among women, it has in fact increased in last 5 years. This country is doing so much of work to prevent or control anemia. You provide IFA supplementation, you do this, you have the agricultural program, you have a school-based nutrition program, you have WAS program, which is being scaled up in this country, and still, you see anemia is increasing. So as a country, you would like to know what are the cause of anemia. That kind of question that should be asked there, as a policy question. That what are the causes of anemia among women in this country? So that a Ministry of Health would know that these are the causes and these should be the program or the approach that needs to be taken to address the problem of anemia. Sometimes here, what I have observed, we become complacent in a sense that if you look at the global nutrition target, it says if a country has more than 50% rate of exclusive breastfeeding, then you are doing well. Now, as a country, let's say Uganda has 66% of exclusive breastfeeding, would you be satisfied just because you are meeting that global target? Or would you try to improve this to the 100%? Why that 34% is still not being breastfed exclusively? So this kind of analysis gives that kind of question or curiosity or queries for you to further explore. And by the way, this is a very descriptive sort of analysis that we have done. This is just like, picking the data from different DHS report and looking at the trends, looking at like, where we are or how we have progressed over the years. Complementary feeding practices. Look at here. Minimum dietary diversity is somewhere around like, 40%. Minimum dietary. That means the maximum, like, only 4 out of 10 children are fed with 4 out of 7 food groups in this country. Isn't that a problem? If it's a problem, what is like, the reason behind? Is it lack of awareness? Is it lack of food? Is it lack of like, agriculture sector's contribution to improve the dietary diversity of the food groups in this country, or availability of or the accessibility of those food in the market itself, or it's like, lack of affordability among the poor population? There could be different like, questions that you could ask. So this is minimum meal frequency, this is minimum dietary diversity, and combining this with the breastfeeding practices, you get a composite indicator where it shows more bleak picture about this country, where we are talking about only 15% of children 6 to 23 months. Only 15, 1 out of 10, are fed with the recommended feeding practices. And there we are talking about like, improving stunting, anemia, this, that. These are some of the practices which we can intervene through like, education program. In terms of what kind of food that children eat, if you look at the iron-rich food, you can see that, like, again, the variation. And that's the same with the vitamin A. Vitamin A is doing better. Only 50 or the 60% of children are like, fed with iron. Vitamin A supplementation. This is considered as one of the key interventions for children 6 to 59 months. And this country, if you look at the coverage, where we are, only almost like how much? It's like 60-something%. Children are given, they get the vitamin A. How can we improve the coverage? What are the bottlenecks? What are the reasons? Is it lack of capacity? We have lack of like, human resource. Is it lack of financing? Is it lack of, I don't know, lack of like, or the stock up out of vitamin A during those programs? What are the reasons? These are the like, if you do the analysis, those kind of questions should be asked or should be answered. So it gives you a clear picture, not only the snapshot, but going into like, deeper. Oh, I'm done. I didn't realize. Thank you.
Quite interesting, a lot of food for thought. And how do you feel about the whole thing? Where are we? Where should we go?
Thank you. I'm just grateful for the analysis that is being done, and we hope to get good results out of the questions you raised. But I'm wondering, how does that, maybe the questions that come out of that analysis reach the sectors which are responsible? Because I can see the analysis could not have been disseminated, so to help us improve on different areas, what are you planning to do as the OPM?
Good. Any other? Yes, Doctor.
The presenter made very good presentation, and I would have loved that he links it to what NIPN is going to do for us. He was asking so many questions that now when you look at the situation of anemia in the country, especially anemia in women, you should be able to ask, what is the cause? And I was saying that maybe now he's going to tell us that now NIPN is going to help us ask that question and analyze and get some policy positions on them. Is that what NIPN is about to do for us?
Yeah, but I think he has.
The plan is, it's, I'm sure the DHS was disseminated in 2018, where they might have presented. I'm not sure because I was not here at that time. I'm just assuming that DHS must have been disseminated widely across sector. If not, then the plan for us is to, as I said, we have done some kind of analysis, and we are trying to enrich with some additional information to give a national outlook. But then before that, we have extracted 4 areas here to develop knowledge products. One is anemia, one is stunting, one is acute malnutrition, and one is dietary practices in children. So we are trying to develop a 2-page or 3-page kind of brief. I wouldn't say policy brief only, but some kind of, you can say fact sheet, or you can say, I don't know, technical brief or working paper, where OPM will publish that and share widely to reach out to the policy or program manager people. So that's where we are. The secondary data analysis. If you look at here, we have looked in more detail about different nutrition outcomes. In terms of, let's say, some area have very low stunting, or some area have very high stunting. What are the regions? We have gone into, like, dig deeper, looking at those data. So I haven't presented those, but the plan is to